Could be the reason.
Yeah, well, it's a question which is worth $1 billion because I don't really know.
Okay.
Because
esteemed audience and viewers, you know, in Skardu city, plastic surgery camp, first time, under the supervisions of the international professor, doctor, experts of the surgical doctor are present, which is really a great honor and a source of encouragement for those patients who cannot bear the expenses of this very expensive, very heavy surgery in rest of the Pakistan. So it's a really great honor. I would like to thank Dr. Professor Umraz Khan Sahab, the head of the department, and Professor Muazzam Nazir Tarar Sahib, and then Professor Dr. Kamran Khalid Sahib. We will most welcome unto the peoples of this region, Skardu Baltistan, to this hospital for your kind services. We would like to appreciate. It's really appreciable, commendable, and admirable coming here and helping the poor, entitled, very poor background entitled patients living here and facing different problems and difficulties they are facing, you know. So thank you again, sir, for coming here. First of all, I would like to ask a few very ordinary general question for the viewers of the Skardu TV channel. I would like to ask one question, sir. How long have you been coming here? Number one. And second part of my question is, how many patients you have been treated? So what sort of nature of the patients? So would you like to give you an explaining a little bit about the numbers of the patients and how long have you been coming?
Thank you very much for this opportunity. I thank on behalf of plastic surgery team to Skardu TV and people of Baltistan that we have the distinct honor of serving since 2008. So since that year we have been coming almost every year. Even during the COVID we did manage to actually hold these camps. And this year the distinction is that we have a world-renowned plastic surgeon from the UK, Professor Umraz Khan, who has very kindly consented to come and has been working with us throughout this camp.
Right.
As far as the number goes, on average every year we do more than 100 surgeries and see more than 300 patients.
Right.
This year our camp was also slightly prolonged. Instead of usual a week or 7 days, this time we are running it for 10 days.
Right.
We have already crossed the mark of 100 complex plastic surgeries, which include correction of cleft lip and palate, which is a congenital or a by birth defect in which the lip is not united and the palate, which is the roof of the mouth, is also not properly formed. So this is a complex surgery which we did. The other major surgeries that Professor Umraz Khan and Professor Kamran Khalid performed with our other esteemed colleagues were hand correction, mainly after burn. The hand of young children, they become contracted. In other words, they cannot open their hands. So that is a very difficult and complex surgery. So they have done quite a few of these patients, and in some children that has afflicted both hands.
Right.
So that each surgery, some of these surgeries took more than 4 hours to do. So that was hard work, and I commend and I'm grateful to Professor Umraz Khan and other team members for carrying out such complex, difficult and lengthy surgeries in this camp.
Right. Thank you, Mr. Sir. The question, as you said, there is a complexities, you know, in surgery. So, you know, in this area, the majority of the peoples, they are very downtrodden people, family background. So they cannot go to the down city. Would you mind telling us, for the audience of the Skardu TV channel, that you were the surgery, the nature of the surgery, the 10 days are enough to healing all that procedures? Or, for example, they're encountering problems, so there is what is your next plan and how can you cope up and how can you advise and give them exhortation, piece of exhortation that next step and then next step, if there is complexities arising, what is the solution for that? Would you mind telling us, explaining that?
First of all, I would like to agree with you that these complex and difficult surgeries usually cost quite a lot, and we are grateful that the patron trustee of Marfi Foundation, Mr. Abdul Fateh Marfi, undertook to sponsor this camp this year, which is obviously going to be more expensive this year, considering the duration and the number of team that is taking part and the number of patients and number of operations that we are doing.
Right.
We've, as I told you, we have done more than 100 complex surgeries.
Right.
There are some patients who would require more elaborate organization, equipment, and other specialists' input, and those patients will be done at Jinnah Burn and Reconstructive Surgery Center.
Right.
We have made arrangements for those patients to come to Lahore, and they will again be staying there in the Marfi guest house, which is again run by Mr. Abdul Fatah Marfi and our coordinator, Mr. Sher Ali, who looks after those patients. We will be treating these patients for the next, it's not just 10 days.
Right.
We actually treat these patients around the year,
right,
throughout the year.
Right.
And these patients, we've given them the dates, and they will keep on coming in on their turns, and we will be operating on them. Some of these patients we will operate in November, when Mr. Umraz Khan will bring 7 or 8 more international experts.
Right.
So some of the Baltistan patients will be treated during that training course,
right,
that we actually hold every year at Jinnah Burn and Reconstructive Surgery Center.
Thank you, sir. Thank you very much for giving the time. I'm really appreciable. Thank you. So I will take one question from the Professor Kamran Khalid, and I will come to you, sir, with your permissions. I would like to take first of all, again say unto the people of Skardu Baltistan, welcome to this land of peace and tranquility. And then I would like to ask one question. So you are the head of the plastic surgery Jinnah Hospital, namely Professor Dr. Kamran Khalid. My first only one question I'm going to ask you. What is your next program? Would you like to tell us chronologically that what's next steps you are going to, giving this camp for the future plans? So would you mind telling us about your next programming for the information of the viewers and audience of Urdu TV channel?
Yes. So thank you very much for giving me the opportunity. I would like to thank all the organization. They are very, very accommodative, and we really enjoyed our stay here. We were very comfortable here. So program here is we run it for the last 14 years.
Okay.
So we now have developed a proper system, and we have we do cases here.
Right.
If any, as you asked Professor Muslim Saab, if any of the, what happens if any complication arises. We usually left one of our senior doctors here,
right,
for the next 1 week or 10 days.
They are taking the responsibility.
Yes, they
right,
look after the cases we have done.
Okay.
In case any minor problem arises, they tackle with it.
Right.
And they take the stitches out and give the follow-up instructions also.
Right.
So basically they take care, and then after that, if there is any problem, our Jinnah Burn and Reconstructive Surgery Center, it's
In Karachi?
No, in Lahore.
In Lahore, right.
That is always there to help.
All right.
Mr. Sher Ali, who is the medical coordinator,
Okay.
he coordinates with us.
All right.
And we ask the patient to come over there.
Right.
And then we treat them.
Right.
So, and especially if there are such patients which can't be treated here, because sometimes they need very special and elaborate instrumentations and facilities.
Right, facilities.
So then we call them there.
Right.
So this is how we do it.
Right.
And for the next future plan is Mr. Umraz Khan came here first time.
Okay.
And this is really very heartening and encouraging for us.
Right.
And he has committed that he will come every year, and he will bring more plastic surgeons from all over the world,
right,
which are of international fame.
Right.
So that's how we are going to even further increase our input here, inshallah.
Right. Thank you, Mr. Thank you. Now I would like to come to the British doctor, Professor Umraz Khan Sahab. Your name is like, you know, it seems to be from Pakistan, but I came to know that you are from Britain. So directly I go to the questions. Would you like to introduce yourselves for the audience of this Kadu TV channel about your academic as well as your professional career shortly, briefly?
Lovely, thank you very much. Yes, like everyone else on this panel today, I'd like to thank the organizers for the opportunity really to come to such a beautiful place. You're right in your, Kamal, in your assertion. My name is a Pathan name.
Right.
My father and mother were from Peshawar.
Okay.
But I grew up in and got educated in England.
All right.
Went to university in London, then did my surgical training,
Right.
did some training in Australia and America, and then finally in 2002 I became a consultant in Britain. So I've been a consultant there for 20 years.
Oh, wow.
I developed a special interest in extremity reconstruction, and as Kamran and Mozam have said, I'm humbled by that. They call me a world expert, but I've developed an expertise in it and an international reputation for good care.
Yeah.
And my affiliation with the Jinnah team, which is led by Kamran, is since 2007.
Right.
We've been running a course for training of plastic surgeons in a technique called microvascular surgery, which is operating under the microscope, where you transplant tissue from one part of the human body to another part.
Right.
And there are parts of our body that you can spare to make a problem better.
Right.
So, for example, the biggest issue is trauma. People get injured, burnt. We can improve their life by undertaking this type of surgery for them.
Right.
We can avoid disability for these patients.
Right.
Patients who have cancer, when before the cancer was said to be too advanced, that it was not operable,
Right.
we can now operate on them.
Right.
So this technique, it gives hope
Right.
to these patients. And that's what we've been, for the last 12, 13 years, been training surgeons in Pakistan for. This is coming to Skardu.
Right.
Has been a great honor, but it's the first time I'm coming.
Okay.
And I was approached by Mozam some time back whether I'd be interested in it.
Right.
And initially I was a bit skeptical, a little bit worried that the techniques that I do, we'll not be able to do here.
Okay.
And he said, it's not the technique. We need your expertise in this and your experience, so that you could give us, guide us, see patients in the clinic.
Right.
So the model of care here is quite good for volume of patients.
Right.
There are 2 or 3 theatres running where patients are being operated on. Simultaneously, in that room, other doctors are seeing new patients from the clinic.
Right.
So every day, the volume of patients is really high.
Right.
In the UK, we'd have very much difficulty in seeing this many patients in this short time.
Yeah, I know that.
We would really struggle.
Oh, yeah, struggle. Right.
But because of the efforts of the people in this hospital,
Right.
the organizers, everybody else, and the understanding of the patients
Right.
who have traveled, I am told, from many, many miles
Right.
to come and get treated, they accept that.
Right.
And we are able to deliver this care.
Right.
And the good thing is, Kamal, I'll tell you,
Okay.
as well as seeing the pathology and treating the patients and seeing the good outcomes,
Right.
the other thing is that the friendship we have, the understanding we have, we work as a team.
Right.
So no one person is like the best, we are all the same and we help each other.
Right.
And I think that way, because my language barrier is a problem, these guys can translate
them.
and some of the equipment that I'm used to in the UK, which we don't have here, they can provide something similar. So we make do.
So it's mean you're encountering the problem and facing the problem in treatment of this, the operations and all the surgery in the absence of the
correct.
equipment. So how do you deal
specialist equipment is very expensive, really expensive, and probably beyond the scope of this hospital at the moment.
Right.
But the way that we get around it is we use techniques that are similar,
Right.
but not as sophisticated.
Right.
But they do the job.
All right.
They get the result for the patient.
Right.
And in that way, we are able to overcome a lot of difficulty.
Right. So my the next question is also again relevant. What would be the reasons of this, abnormalities? Could you give the reasons of abnormalities, and what sort of natures of abnormalities are found in Skardu Baltistan as compared to the American, the British, and different places you have been? What could be the reasons?
It's a question which is worth $1 billion, because I don't really know.
Okay.
Because it's often genetic.
All right.
For example, the cleft lip and palate congenital abnormality and the hand abnormalities,
right.
they're genetically linked. Genetically linked. So whether it's due to mutations or whether it's due to consanguineous marriages, do you understand that?
I know that.
Yeah, I don't know, but it's a genetic fault somewhere along development that led to the abnormality. And we know as a group that when tissue is not there, that's supposed to be there,
right,
plastic surgeons need to come in and help.
So it's mean that it's not, you cannot give the precautionary measurement like other diseases we can give.
No,
you can give.
You can't say stop smoking.
All right. You can give them precautionary measurements.
There is nutrition, so
right.
there is. People do say if you lack folic acid in your diet during pregnancy,
right,
that could lead to some birth defects,
right,
spinal bifida and stuff like that. But for a lot of these, it's very, very difficult, and it could well be that there are genetic mutations which lead to that and cause those. But the other thing, Kamal, which is really important for your audience and everyone to understand,
right,
is that sustaining a burn as a child is very common in Pakistan. In the UK, it's not that common.
Right.
In the Western world, big burns are coming down in terms of frequency and incidence and prevalence. In the developing world, Southeast Asia, it's still very high. And remember, patients who have a burn on their back or their stomach, they can hide it.
Right.
If it's on their face or their hands, on their legs, they can't hide the face. The hands means they can't use the hands to work,
right,
and the feet and legs mean they can't walk. Right. So they are disabled. Right. And what we do, what has been done by the team,
right,
is it reduces the disability that these patients suffer,
right,
for their life, which is a great thing to do.
Right. Thank you, sir, for your very valuable, informative, didactic ideas. A few more questions, with your permission, if we have time.
We do have
to take a few questions.
I think we have the time.
So my third question is, as we know, and you have the philanthropic zeal and to serve for humanity.
Yes.
So my question is, how did you build this passion in serving humanity across the globe? Because in international, we have many times observed they are more this field is lucrative. Doctors like international doctors and national doctors, national doctors, they are more money motivated, money oriented. So doing away with all this money motivated, money motivated and oriented things, you are coming here since this undeveloped and even I would say I would use the words backward area, and to serving the most entitled and deserving poor patients. So would you mind telling me and explain me how this patient?
Okay, so it goes back a long time with me. When my father was alive, Hamid Khan, his name was.
Right.
And I was one of the first in our family to become a doctor, to do medicine.
Right.
And I made a promise to him that because I've been given this opportunity and gift, that I will one day help the poor and needy of Pakistan. That was years ago, 1980s. And now I have the opportunity to do that. Now I have the links to be able to serve that promise.
Right.
And people have very little access to good health care in Pakistan. They really do. There is a statistic that more people have smartphones than access to health care in Pakistan.
Right. Yeah.
So that is a tragedy. Where healthcare is needed most, it is lacking.
Right.
So if and there might be medics in your audience, if your motivation to do medicine is money,
right,
good luck to you, because there's nothing wrong with that. I mean, you know, we're a capitalist society, nothing wrong with that. But I think that more fulfilling than monetary gains is to help people who truly can't afford anything and are deserving of the basic of healthcare.
Thank you, sir. My second question, my fourth question is, would you like to give any message to the people of Skardu especially to create healthful, favorable conditions, you know, to avoid from the different diseases if you have observed here? So would you like to give any message in terms of, you know, healthy environment?
So I'm not here to give any public health advice, but what I would say is, and I've noticed that many patients that I've seen over the last week are malnourished. They are really weak. They don't eat well. They have a very poor constitution. So they must make sure that if they are unwell, that they are eating a balanced diet if they can afford it. The second thing I'd say is a public health thing. You have to make sure safety first. So I would rather there were no burn patients, i.e. 0 burns.
All right.
So patients do not tamper with hot flames, keep children away from the kitchen area. When people are cooking, they don't have a stove that's open, it's on a high place, they are aware of it. Electric cables are hidden and protected from children who want to put their fingers in and get electrocuted. These are simple but practical ways of avoiding a burn injury. For accidents like road traffic accidents, motorbike, I've seen so many young children, teenagers, 3 or 4 on one motorbike, no crash helmet, and they are driving really fast. This is important because traffic control everywhere in the world is bad, but is really bad in Pakistan and Southeast Asia. And therefore, road safety, always be aware, always show your lights, make sure if your light is broken that you fix it. These are really important things because they can stop you from having to meet someone like me. And if you don't need to meet someone like me, it means that you're not injured or burnt or stuff like that, and that's really important.
So my one question is, you know, relevant to these patients. So my question, for example, like a lift clipped and different kinds.
Yes.
So would you like to give the information for the audience of the Skardu TV channel?
Yes.
Which age is favorable for the operation? For example, due to the lack of the opportunity from the international, like you as experts, off and on used to come to here. It's the first time international experts. Thank you very much for your kind help and for your humanity. The zeal is just really appreciable and commendable. So would you like to give any advice to the parents and then the patients? They have the lip cliff like this, like so and so on. So which age would be the favorable, like, would you like to give them a few expertise?
Yes, the most important thing, of course, is, you know, we know life is sacred. Every child born, even if they're born with a deformity, must be loved. They must be cared for. They must seek medical opinion as soon as possible. Usually, if the child is born in a hospital, they will get it. But if the child is born at home, they won't get it.
And they don't take care of that.
They don't, and you must go and seek help. Not that they will offer you an operation straight away. There is a very predictable and predetermined timing for repairing cleft lip and palate. And there is a spectrum of disease. It is not just one for every patient. They're all different formation. And therefore they need the care which is individualized to that child. So seek help immediately as soon as the child is born. Make sure that the specialists see them, that they can breathe, they can feed, and therefore thrive. And then the plastic surgeon will then see them to assess how bad the deformity is, and that will then allow the plastic surgeon to prescribe a safe treatment for that child. And usually the lip and the palate are done either separately or together. And if you have a bilateral cleft lip, that's a different thing. There are different variations of a cleft lip. Sometimes children don't have a deformity,
Okay.
but they have clefting, which is
Cleft.
under the skin. You can't see it.
Okay.
And their speech does not develop properly.
Okay.
They can't talk properly.
They can't talk properly.
And when they drink water, it comes out of their nose.
Right.
And that, again, seek medical advice. The sooner they do it, the better it is.
Okay.
Now, it's easy for me to say that because I don't understand the financial
Implications.
for the parents
Yeah.
of doing that.
Yeah.
But whatever the cost is worth it because the child is precious.
If they are late due to the financial pressure,
Yeah.
right? So is there
You can still do them.
impossibilities
No,
or
no,
is there
no, you can-
possibilities
you-
is resting on it?
If for example, here we have seen adults
Right.
in their 20s and 30s with a cleft palate.
All right.
They've lived with it all that time,
Okay.
being scared to talk
Yes,
to
yeah,
anyone.
to talk.
It's better to do it earlier because if it's on one side, it's easier to allow the face to grow once it's been repaired, but it's not impossible to treat it in adulthood.
Right.
We would prefer children.
Right. Skardu TV channel, esteemed audience, we are with Pakistani British Professor Dr. Uzair Khan with us. And I would like to talk one more question for you. Of
course.
It's coming in my mind. How would you guide to all the experts and the medical scientists in the world to visit Skardu and would like to give them guidelines they can come here conveniently and what sort of patient they can treat and resting? But you cannot in this with the narrowness of time, you cannot have the operations of every deserving entitled patients.
No.
So would you like to give the guidance to the international, all these medical scientists coming to visit to this peace, this land of peace and tranquility, which is now in Skardu, Baltistan? So would you like to give them advice and guide to the international people? This is my last question.
Sure, sure. Well, it's a very complex question, but I have an answer, which is it is easy to get here. It was pretty painless. The transport, and this is the northern part of Pakistan, as it borders India and China. But although isolated, it is accessible both by road and by air. We came by road up because the weather was bad. Our flight got cancelled. That does not dissuade us. It was a 2-day journey from Islamabad up to here.
Right.
But the getting here is not a big issue. Staying here is not a big issue. We are staying in a wonderful place, very basic but clean and friendly staff. But for people who wish to do it, they can't just turn up to the hospital and say, I'm a heart surgeon, I want to do some operation. It doesn't work like that. You have to link in with an NGO.
Right.
And the NGOs are very, very important in the whole jigsaw, which is this philanthropic work. And the reason they're important is they enable people like myself to come to places like here and to be looked after by locals who they entrust.
All right.
Personal security, a lot of people are scared to go away from their very secure environments in the West. I have felt nothing but secure in this city, and indeed we've been on 1 or 2 excursions to see the wonders of natural beauty, as you say, of this tranquil part of Pakistan. For me, or someone with Pakistan roots, did not know that such a place existed in Pakistan.
Right.
I just assumed they're all dusty cities like Peshawar used to be when I remember it.
Exactly.
So don't be scared. There are many people out there, if you just search on the web, about NGOs who do this type of work in Skardu and the surrounding areas, no doubt. But to get the most out of it, you have to link it with an NGO. Once you do that, for example, Sher Ali, who's been mentioned more than once, who coordinates the camp, will ensure that the camp is advertised to people. If they don't know you're coming, they're not going to come. But if they're advertised before, and you can see the posters are everywhere, then patients will come and be treated, and you will not have a wasted journey. So engage with an NGO, be realistic in what you can achieve. This is not a high-tech hospital. You can't have very complex procedures done here, but basic care, basic surgical and basic medical care, like pediatricians, if they came and looked at the nutrition side of things for children, I'm sure there will be a way to improve the health of the people in Scotland.
Thank you, sir. Esteemed audience and viewers, we are here with British Professor Dr. Umraz Khan at the place of Abdullah Hospital. Plastic surgery camp is going on, sponsored by Abdullah Fatah Marfi. And thank you very much, sir, for giving me the time, and thank you for your lovely words and thought-provoking ideas. And thank you very much for. There is no words to express for you. Thanking for this.
It's my pleasure. It's my pleasure.
Thank you, sir.
Bye bye.
Bye bye. Take care.